I'm Caitlin. Nice to meet you.
Hi, I'm Abby. Nice to meet you too.
As part of our swallowing evaluation today, we're going to start off with a medical history. So I'm just going to ask you some questions.
Okay.
So our first question is, why are you here today? Or are you having any trouble swallowing?
No. So basically my mom recommended that I come. She's just kind of wanting to make sure everything is safe and working properly. I haven't noticed any swallowing difficulties, but I just kind of wanted to come today to get checked out and make sure everything's working okay.
Okay. Have you had a cold recently?
No.
That's good. Do you or your family have a history of disease or illness present since birth?
No, there's no congenital diseases present in my family that I'm aware of.
Okay. What about neurologic diseases or strokes?
No and no. No history of stroke or brain diseases that I'm aware of.
Have you had any surgeries that require anesthesia?
No, I've never had a surgery in my life, so.
Are you aware of any current or recent infections? And do you have a history of dehydration or malnutrition?
Neither. I'm not aware of any infections. I'm pretty healthy as of late, and I don't have a history of malnutrition or dehydration.
That's good. Have you ever had difficulty breathing or respiratory problems like coughing, choking, wheezing, asthma, COPD, or tightness within your chest?
No, I don't think to any of them. I mean, I've definitely coughed before, but usually if I have a cold or there's reason for it, not just out of the blue.
Okay. Do you wear dentures?
No.
Do you have any esophageal diseases that you're aware of, such as GERD or reflux?
No.
Do you have history of any head or neck cancer?
No, no cancer in my family.
Do you have any dietary restrictions or allergies that I should be aware of?
No, I'm not allergic to anything.
What medications are you currently taking?
I'm not currently taking any medications. I used to take a monthly contraceptive, but I haven't been taking that for over a year.
Okay. Next, we're going to move on to our oral mechanism exam. So that's just going to look at the different structures within your mouth, so like your teeth, your lips, your tongue, and just to make sure that everything's working properly and that all of your muscles are strong enough to help you swallow.
Okay.
So first, I'm just going to ask you to look at me, and I'm going to check the symmetry of your face. Everything looks great. There's no drooping and there's no spasms, and I don't recognize any mouth breathing, so that's good. Our next evaluation is going to be of your jaw and your teeth. So I'm first going to ask you to open and close your mouth so I can look at the symmetry and the musculature. So just like this. Good. Everything looks normal. There's normal range of motion. There's normal symmetry. Nothing's deviating to one side or the next. The next thing I would like to look at is your dentition. So I would like to look at your teeth. If you can smile with your teeth. Great. That was to look at, make sure there's normal closure, and to look for overbites, which you have normal closure. There's no overbites, and I didn't see any missing teeth, and it seems like you have pretty good dental hygiene. The next thing I would like to look at is and I would like to evaluate your lips. So the first thing I would like you to do is to pucker your lips so I can check the range of motion, symmetry, and the strength. So like this, and retract it. One more time. Good. Everything looks great. There's normal range of motion, symmetry, just like everything else. All right, next I would like to see you smile so I can check that the sides of your mouth have normal range of motion and that they are also symmetrical. So smile. Good. I don't see any drooping and there's no asymmetries on one side or the other. Next, I would like you to puff your cheeks and hold your air like a chipmunk. And when you do this, I'm going to press on them to make sure that you have the strength in your cheeks to hold the air in. So go ahead and, good. Perfect. You held the air in, and that was great, and there was nothing coming out of your nose, and that's what we're looking for. Next, I'm going to evaluate your tongue. So I'm going to ask you to do a bunch of tongue exercises. So first, just stick out your tongue so I can look at it. Great. There's normal coloration and there's no abnormalities. The next, I'm gonna ask you to open your mouth again so I can look at the way back of your mouth. Good, and then can you lift your tongue up? Great, that was to look at your frenulum, which is that bottom piece of your tongue, to make sure that there's normal strength and elasticity. Next, I'm gonna ask you to protrude and retract your tongue so I can see once again, the range of motion and that there's no movement from side to side when you do this. So like this. Good. Everything looked normal with that, and that was really great. Next, I'm gonna ask you to move your tongue from one side to the next, so from right to left. Good. That was to look at the range of motion and symmetry from side to side versus the up and down like we did with the last one. Next, I want you to move your tongue tip up and down. So look, once again, the range of motion of up and down and your strength. So like this. Good. That was kind of hard with coordination, but you did a good job. Everything looks normal. The next thing I'm gonna push against your tongue, and I'm gonna put it on the top of your tongue like this, and I want you to push up against it so I can check your resistance. Good, everything's normal, and I want you to do the same thing, pushing down on it. Nice job. Next, we're gonna go back to that side-to-side motion, and I wanna look at your oral motor coordination of it side to side, and I would like you to do this as fast as you can. Good, great coordination. And the last thing I'm gonna do is I'm gonna look at your tonsils and the way back of your mouth. I'm gonna look at the coloration as well as to make sure that there's no abnormalities. Color looks nice and pink, and I don't see anything abnormal. So you passed your oral Mech exam.
Awesome.